Welcome to this explainer. Let's jump right in because today we are exploring the ultimate medical paradox. I want you to imagine holding the absolute perfect, most flawless cancer-killing molecule right in the palm of your hand. But there's a catch, a massive one. It's so incredibly toxic to deliver and so unbelievably scarce in nature that it's almost impossible to actually use it to save a life. The entire history of its development can basically be summed up by four massive roadblocks: no solubility, no supply, no formulation, and no mechanism. I mean, talk about incredible narrative tension, right? Researchers knew they had a literal miracle cure on their hands, something that could potentially save someone you know and love, but they were facing literally impossible odds to get it into a human being safely. We're going to unpack exactly why every single one of these barriers existed.
Okay, let's dive into this. We are looking at an epic 40-year historical scope here. From 1962, when the biological material was first collected, to 1971, when the structure was finally named, all the way to a major mechanism discovery in 1979, FDA approval in 1992, and then a massive nanomedicine breakthrough in 2005. It's this fascinating mystery box of compounding problems and brilliant outside-the-box solutions that just completely revolutionized modern medicine. So let's explore exactly how this whole thing unfolded.
Section 1. Discovery and Paradox, a Medical Crisis. So way back in August 1962, a USDA botanist named Arthur Barclay collected bark, twigs, and needles from a single Pacific yew tree in Washington state's Gifford-Pinchot National Forest. By 1964, researchers found that this crude bark extract was highly cytotoxic, meaning it was incredibly lethal to cancer cells. It was absolutely devastating to tumors in the lab. But to actually use this as a viable medicine, well, it presented an immediate and severe crisis. That crisis came down to a catastrophic biological bottleneck: 350 milligrams. Let's put that into perspective. When scientists tried to extract the active drug, destroying an entire 100-year-old tree yielded barely 350 milligrams. That is barely enough for a single dose for just one patient. And harvesting the bark didn't just hurt the tree, it killed it entirely. The environmental cost of scaling this up to treat thousands of cancer patients was just unfathomable. There was no way. Section 2. Freezing the cancer cell, a mechanism breakthrough. Because of that massive supply issue and the fact that the drug was profoundly hydrophobic, meaning it completely refused to dissolve in water, development entirely stalled out in the 1970s. For a long time, no one even knew how the molecule actually worked inside the body, so funding just dried up. That is until a massive scientific breakthrough by Dr. Susan B. Horowitz in 1979 changed absolutely everything. Now, what's really interesting about this slide is the true genius behind the mechanism she uncovered. Microtubules are vital cellular structures that basically act like an engine for cell division and mitosis. At the time, other anti-cancer drugs worked by blowing these structures apart, totally destroying them to stop the cell from dividing. But Dr. Horowitz found that paclitaxel did the exact opposite. It literally froze them in place. It stabilized the microtubules, kept them from pulling apart during division, and completely halted cancer growth in its tracks. This was a completely unprecedented way to fight cancer. Section 3. The formulation nightmare, toxic solvents. This brilliant discovery reignited interest across the entire scientific community and pushed the drug into clinical trials. But to actually get it into a patient's veins, scientists had to solve that water solubility problem. They were essentially forced to use a brute force chemistry approach. They relied on a highly toxic chemical solvent called chromophore-EL, which is basically a really harsh polyethylated castor oil, mixed directly with dehydrated ethanol. The side effects of this delivery method, they were absolutely devastating. A staggering 41%. That's the percentage of clinical trial patients who suffered horrific hypersensitivity and severe anaphylactoid shock simply because of this castor oil solvent. It was a complete nightmare for patients who were, already battling cancer. The solvent stuck around in their blood for a full week, altering how the drug was distributed and heavily increasing toxicity. It was so incredibly harsh that it literally melted the plasticizers right out of standard PVC IV bags, sending toxic plastics directly into the patient's bloodstream. Walk with me through this visceral, honestly grueling medical timeline doctors had to follow just to get this drug into a patient safely. Step 1. Administer heavy corticosteroids 12 hours before the infusion. Step 2. Give strong antihistamines 6 hours before. Step 3. Hook up special, super expensive non-PVC IV bags and tubing so the solvent wouldn't melt the plastic. And Step 4. run agonizingly slow, 3 to 24-hour-long infusions just to try and avoid sending the patient into acute shock. The massive clinical burden placed on vulnerable patients just to tolerate the solvent was immense.
Section 4. Solving the supply crisis, saving the U. So, as the drug stubbornly moved toward the commercial market, we hit yet another wall. We were facing a simultaneous environmental disaster in the late 1980s. Remember those super low yields from earlier? To treat just a single cancer patient, you had to cut down 2 to 3 endangered Pacific yew trees. Environmental groups were actively protesting in the forests, and mathematically speaking, there simply weren't enough trees on planet Earth to supply the patients who desperately needed this cure. Semisynthesis. The brilliant workaround for this came from scientists like Pierre Pontier. His solution was a highly detailed process called semisynthesis. Pontier discovered a precursor chemical right in the needles of the common European yew tree. Now, unlike tree bark, needles are completely renewable. You don't have to chop down and kill the tree to harvest them. Scientists realized they could just harvest these renewable needles, extract the precursor, and chemically convert it in the lab into paclitaxel. This absolute stroke of genius completely halted the deforestation issue and permanently solved the supply crisis. Section 5. The Nanomedicine Revolution, a new paradigm. Okay, so we now have an abundant supply, we have the miracle drug, but we still have a highly toxic, totally dangerous delivery system holding it all back. In the 1980s and 90s, a pioneer named Patrick Couvreur was doing some truly groundbreaking work. Big Pharma initially thought nanocarriers were just some academic fantasy, but Couvreur proved that microscopic nanoparticles could fundamentally change how a drug is distributed in the body. He completely shifted the scientific consensus by proving that a drug's delivery system is actually a drug itself. This profound conceptual leap paved the way for a really elegant, pivotal question asked by researchers who were desperately trying to finally ditch that toxic chemical formulation for a biological one. They asked, why not just use human albumin as the solvent? Think about it. Human serum albumin naturally transports hydrophobic molecules like fats and hormones throughout our bodies every single day. So why couldn't it transport our cancer drug? The answer to that is NAB technology, or nanoparticle albumin-bound technology. Researchers took the paclitaxel molecule and they literally smashed it together with human albumin under extreme high pressure. This sheared the mixture into microscopic 130 nanometer delivery particles. This brand new formulation became the drug Abraxane. The absolute genius here is that malignant tumors naturally have a high demand for albumin to fuel their rapid growth. By packaging the drug inside albumin, the medicine actively exploits tumor biology itself, basically tricking the cancer into pulling the poison right inside, all without needing a single drop of toxic chemophore or ethanol. And this brilliantly illustrates the massive clinical difference for patient outcomes when you compare these two eras side by side. The old Taxol era relied entirely on a harsh chemical solvent, which caused severe hypersensitivity reactions and heavily restricted the maximum safe dose to just 175 milligrams. The new Abraxane era, though, it utilizes a human protein nanoparticle, requiring absolutely zero heavy premedication to tolerate. By finally stripping away that toxic solvent, doctors were able to safely deliver a 50% higher dose of the actual cancer-killing medicine, pushing it all the way up to 260 milligrams, a total game changer. Let's rapidly highlight these immense clinical upgrades and why they matter so much to patients fighting for their lives. Approved by the FDA in January 2005, this drug could now be infused safely in just 30 minutes, instead of confining a patient to a hospital bed for up to 24 hours. Zero steroid premedication was required, completely sparing patients from debilitating side effects. And most crucially of all, the response rate in the pivotal trial nearly doubled, jumping from 11.1% for Taxol to 21.5% for Abraxane. Over 40 years, this drug successfully transitioned from a tree-killing, patient-poisoning bark extract into a billion-dollar essential medicine universally recognized by the WHO. Which brings us to a final, really provocative thought to leave you with today. How many other quote-unquote failed drugs in history are simply sitting on a shelf somewhere, just waiting for the perfect delivery system? Think about that unseen potential for a second. A perfect molecule is really only as good as the vehicle that carries it into the cell. Thank you so much for joining me for this explainer. I really hope it gave you some fantastic insights into the incredible world of medical problem solving. See you next time.